Welcome. Thank you for tuning into our Facebook Live media conference. Today's presenters are Mark Henry, Chairperson of the Clinton County Legislature, John Canosa, Director of Public Health for Clinton County, Eric Day, Director of the Clinton County Office of Emergency Services, and Sheriff Dave Favreau. These individuals represent the unified command system that has been established in Clinton County to address COVID-19. Each will offer prepared comments, and then, to the best of our abilities, we will respond to media and public questions coming through the live stream. Since we anticipate duplicate questions on the same topic, please listen carefully, as the information you are seeking may be answered as part of a response to a combination of questions. At this point, I invite Honorable Mark Henry to the podium.
Thank you. Good morning, and thank you for joining us today. My name is Mark Henry. I am Chairman of the Clinton County Legislature, but I'm also here in my secondary role as a commander with the Unified Incident Command for Clinton County. As we spoke about earlier, I'm joined by Eric Day, the Director of the Emergency Services, Sheriff Favreau, and John Canosa, Director of Public Health. This press conference this morning is designed to provide an update on the response by Clinton County to the COVID-19 crisis. We recognize the hardship and the uncertainty this crisis has placed on all of you. None of us have been here before, and we thank you all for the efforts that you are currently doing, separation. We recognize the hardship of closing businesses and having to stay home. You're making a difference in helping us to limit the spread of this virus. The role of Clinton County during this crisis is to coordinate the response to and the communications about the COVID-19 outbreak in Clinton County. I will provide a brief update on the activities taking place and ask our department heads to provide more detail. Our actions to date, we have declared a state of emergency for Clinton County, as I'm sure you're all aware of. New York State has as well. This was to emphasize the seriousness of the event, and it allows the county to reduce the standard limitations on purchasing and other procedures, which will allow us to better respond to this emergency. We've activated the Emergency Operations Center, bringing together the involved agencies and organizations to better coordinate the COVID-19 response. Following the governor's directive and executive orders to reduce the county workforce to essential employees only by at least 50%, we are at that 50% level. I believe we are below the 50% level by quite a bit. This too is designed to help limit the spread and flatten the curve. I know you all have heard about that. With a few exceptions, as required by New York State, Clinton County government is still open and operating. But the reduced workforce means reduced capacity, so please be patient. If you plan to use Clinton County services, I urge you to visit our website, www.clintoncountygov.com. That's www.clintoncountygov.com. And Clinton County Gov is one word. To view the services that are being offered by the county at any time. There has been some disruption, obviously, but we are open, and we will serve you as quickly as we can. We have also contracted with several motel owners to provide quarantine capacity if that becomes necessary. We have taken legislative action to cancel the interest charges on real property tax installment payments during the month of March. This is in recognition of the many individuals, many of you that are hurting right now and may have trouble making those payments. In the process of filing an amendment to our foreclosure order, we have chosen not to proceed, which is actually a good thing. This will allow real property foreclosures this year to roll over into next year. Future considerations. Clinton County will suffer economically from the COVID-19, and so too will many Clinton County businesses and individuals. People will lose their jobs or at least suffer weeks without pay. Businesses may close for extended periods. Together, with my colleagues in the legislature, we will be discussing other ways in which the county can ease the pain and harm so many are suffering as a result of this crisis. We understand the need, and we will be discussing ways we can help. The important thing right now is to focus on reducing the health impact of the virus and minimize the number of positive cases in Clinton County. Please stay calm. Please stay at home. We will get through this with everyone's cooperation. I want to thank the healthcare workers, the doctors and nurses, our first responders, all of our employees, our municipal officials, for all that they are doing. As part of our team, Michael Cashman, the supervisor of the town of Plattsburgh, is also acting as a liaison for us for all of the villages and towns, cities with the mayors of our county. So I'd like to thank Michael Cashman. I'd like to thank Mayor Colin Reed for all that he's doing as well. That would be the conclusion of my remarks. Again, thanks to all. I would like to turn it over to John Canosa. Mr. Canosa is the Clinton County Director of Public Health. John and his team has been in the front lines of this since day one, and he will update you on the activities of his department. John?
Thank you, Mark. First, we at the Health Department thank the public for their efforts in maximizing social distancing, their own personal efforts to regularly wash their hands, keep sanitary, and also simply hang in there. These individual personal efforts taken by us all will definitely serve to minimize the spread of COVID-19 in our county in the weeks to come. Please continue, where possible, to minimize your distance, proximity to anyone else that you know in your communities. We also want to thank our numerous partners in the county, CVPH, Champlain Valley Educational Services, local medical providers, the City of Plattsburgh, Town of Plattsburgh, and other local towns and villages for their continuous support, communication, and assistance in all matters relating to this emergency. Our statistics at this time include positive cases, 11, which includes 1 probable and 1 inmate at Clinton Correctional, 108 negative tests, 67 people in quarantine, 12 in isolation, total testing to date, 119. You should all know some of the work that our staff, the CCHD, has been doing for the last couple of months. Specifically, we have been communicating with local, state, and federal officials from the start, since the beginning of February. We have been receiving reports of cases confirmed positive or ruled negative, where one of our largest efforts has been focused on contact tracing. When we have cases that are reported to us that we find out, we have to find out every possible connection that person would have to other people in the community. We're monitoring those in isolation and quarantine daily. We have a call center set up here at the Health Department, which has been established to respond to questions, to direct callers from the public, to connect them with other resources and answer some general questions. We are communicating messages to the public about personal protective measures through social media, media releases, as well as media events like this. And we are communicating case numbers daily to the media via press releases. The continued contact tracing work done by our nurses and support staff is surely showing some positive results. As 7 of our 11 cases are connected to one specific positive case. that says our contact tracing is working. Our partners at CVPH have worked ever diligently in recent weeks to ramp up their bed capacity as requested by the governor. Many people are asking, what if I get sick? Our recommendation continues to be, stay home, monitor and treat your symptoms. Call your healthcare provider to discuss symptoms that you are concerned about, fever, cough, especially if you are feeling short of breath. If symptoms are severe, please call 911. And please tell them when you call 911, you have flu symptoms. Let them know what they are coming to. Another question, should I go to the emergency room? Ask yourself, would I go to the emergency room for these symptoms under normal circumstances? Coughs, fevers, sore throats, runny noses have rarely been a reason to go to the emergency room in the past. Even if your symptoms are due to coronavirus, they are probably not an emergency. Most people will get mild to medium symptoms and will recover on their own. Most importantly, if you have symptoms, don't spread the illness to others. If you have symptoms of the virus but haven't been tested, you should assume you have it, that you have coronavirus, and take precautions. Care for mild to moderate symptoms of coronavirus, similar to caring for the flu. Fluids, soups, over-the-counter cough medicines, pain relievers can be used to ease symptoms, make you feel better. Take your temperature regularly. Feeling so sick or weak that you can't eat, drink, or go to the bathroom are reasons to seek medical attention. In addition to extending our sincere appreciation to the public, to our numerous healthcare providers in our area who continue to serve the public daily, I also want to extend a big thanks to the workers at our local supermarkets, grocery stores, who continue to work to serve the public in a similar way, face-to-face, meeting the public every day. To them, I simply reiterate our one priority message to protect yourselves. Wash your hands regularly, wear gloves, always try to maintain social distancing where possible. Finally, in closing, I repeat our sincere thanks to the public. Again, please keep up your efforts to maintain your own personal protection efforts, including, especially, social distancing. Thank you, and I now turn the floor over to Eric Day.
Thank you, John. Good morning. I'd like to confirm that many county departments considered essential service providers are fully engaged in the COVID-19 response, and we're in communication daily to coordinate those activities. The discussions you're hearing this morning here echo that. The Office of Emergency Services is facilitating the use of the Incident Command System to provide coordination, structure, and information sharing within county departments, as well as with our town, village, and city governments, emergency responders, and other community partners. In reference specifically to emergency responders, please rest assured that our system, 911, police, fire, EMS, for responding to emergencies is fully in place, capable, and ready to go. At this time, there are no debilitations of those services. I would like to take just a second to reach out to the emergency service providers themselves and thank them all for their ability and readiness to be able to respond during this difficult time. It's critical that we keep those services functioning, and those people are doing a good job with that. The logistics section of our incident command structure is just one of several working arms of that structure, and staff are working long hours to meet logistical needs of the incident and are distributing resources including masks, gowns, gloves, eye protection, and hand sanitizer to medical care professionals at the hospital, as well as service providers in the field, medical offices, law enforcement, fire and EMS responders, long-term care, nursing home facilities, and others. These types of resources, as you well know, are very limited in supply worldwide, but we continue locally to work with the many sources that we can, including vendors, donations. We have folks coming in that have actually offered donations of some of these medical supplies that we greatly will accept from anybody, and in turn distribute those appropriately to the agencies and partners that are in need. We've received donations of PPE, masks from dentist offices that are closed because their practice is not functioning at this time due to the reduction in services. Local surplus vendors have actually been very helpful in providing masks. And then, of course, we're working with our largest supplier, the state of New York, MERC, or Medical Emergency Response Cash, and that is also supplied by the Federal Strategic National Stockpile. We work daily with those folks to try to continue to put in requests and obtain resources back here in our county. With that, next I'd like to introduce Sheriff Dave Favreau for his remarks.
Thank you, Eric. Good morning. I echo the comments from each of the members of the Incident Command System. I'd like to tell the general public that the Clinton County Sheriff's Office is in full function for law enforcement and for corrections. Our services, as well as all other county agencies, have been altered due to staffing and due to necessities. So I would urge you to please use our website. You can go to our Facebook. We have a Twitter account, or even use the telephone and call us so that you can find out what service you may be inquiring, if that's still available. If it's an emergency service, 911, and you'll get the first immediate response from law enforcement. We're in unprecedented times that we've never seen before. Clinton County has always been a community of resiliency. We can go back into recent history with the Dannemora prison escape, seeing hundreds of law enforcement members up here, thousands of members of the community, in what was described in some points as a panic state. But the underlying story behind that issue is really it was an opportunity for the public to show what we're made of, and once again we did. Over 2 decades ago, we faced the ice storm that people said we'll never see a catastrophic event like this again. North Country stood up and we did what we needed to do. This is different. People, please listen. This is different. In law enforcement, we're aiming at a moving, invisible target. The health department has done an amazing job at being able to track this. It is becoming overwhelming. They're getting a lot of assistance, but the greatest assistance that we can get, and the only way we're going to combat this invisible, constantly moving target, is with the eyes and the ears of the general public. If you see group gatherings, you need to notify us so that we can address it right away. You need to stay home. You need to use your telephone and communicate with members of your family. You can use a variety of social media to stay in touch with members of your family. But getting together is only going to cross-contaminate and create a bigger problem for the already hard-working members of this team to be able to combat this issue. So once again, the social distancing, the staying home is the best thing that you can do. If we're going to conquer the darkness that this is bringing upon us, we need to follow these simple guidelines. The social distancing, hand sanitizing, staying home, and as Director Canosa brought out earlier, communications, that's critical. If you're not feeling well, let a family member know so they can assist you as to what to do. And also, most importantly, if you are in a job environment, particularly in public assistance, let your supervisors know so that they can make the appropriate decisions so that you don't come to work and unnecessarily infect somebody at work, which can cripple the efforts that we're putting forth right now. Thank you.
We will now begin to respond to questions that we've been receiving through Facebook. I wanted to just let people know that Erin Strife, our Director of Healthcare Services here at the Clinton County Health Department, is also on hand to answer some of those health-related questions, so you may see her at the podium. The questions will be asked by our team who's been monitoring them, and we will quickly determine who is going to respond to that, and they will come to the podium. Thank you.
The first question we'll ask is, why doesn't Clinton County have enough tests?
Number of tests that are available to Clinton County, as well as New York State, as well as in the country right now, is very limited. They are ramping up, as we understand, quite quickly. There are new testing methodologies coming out We're hoping to get more. We are aware that CVPH in the present week, present day, has enough tests. We obviously would like to expand our testing to include more of the general population as possible. Testing will only be, into the future, accommodated for those, however, who present with symptoms. We do not have the ability, nor does any county or state have the ability to test everybody. So we will hopefully be seeing more testing kits, testing swabs, coming in the upcoming week, and hopefully into the future they will keep coming in.
Next, more questions on more clarification for the testing criteria and how people get tested.
Hello. Testing occurs right now primarily for people who are ill enough to be hospitalized. Unfortunately, we have very limited testing supplies in this county. We do not know when we will be receiving additional test kits, and we need to use the supplies that we have as judiciously as possible. That means that people who are ill enough to be hospitalized get tested because they are being placed within the hospital on designated COVID-19 units to try to contain the spread of the virus to the extent that we possibly can. There are other circumstances that may warrant testing, including, for example, if we have frontline staff, emergency personnel who develop symptoms and have been working for a period of time while sick and exposing other potentially vulnerable individuals. Those people will get tested in order to assist the health department with contact tracing, isolation, and quarantine of anyone who may have been exposed. I believe I'm going to just go into the next question, which was related, but there was a question speaking to the positive test result in an inmate at Clinton Correctional Facility. It's related because there are additional people who did come in contact with that person, the prisoner. It doesn't necessarily warrant that a person who came in contact with the prisoner now be tested, even if they do develop symptoms. If they did not have a large number of contacts who they were around while they were symptomatic, they are going to be asked to isolate themselves in their homes. And if they do become sick enough to need hospital care, they will go to the hospital. And then that will, of course, warrant testing so they can be assigned to the correct unit within the hospital. We are continuing to work with Clinton Correctional Facility. We are working with their infection control staff at the facility. We are working with the State Department of Health. We have been in conversation with docs, and Assemblyman Billy Jones is helping us further our communications with that facility in order to do the best job that we possibly can in terms of contact tracing and subsequent isolation and quarantine of individuals who did come in contact with the prisoner while he was symptomatic.
How many of the cases in Clinton County are serious or critical?
That's difficult to say. There are, I believe at this time, 4 people hospitalized. That was as of this morning. We do not get necessarily up to the minute updates from the hospital as they're seeing people. They need to make some determinations about whether they need to remain in the hospital or whether they can then return home and manage their symptoms at home. I don't want to downplay the dangerous nature of this virus. We do know that most people will be able to manage their symptoms at home, but that does not mean that anyone wants to have these types of symptoms that people are experiencing when they're sick with COVID-19. They are unpleasant at best and life-threatening at worst, so we need to be vigilant in maintaining our social distancing.
From there, can you speak to what the general public should do if they are experiencing symptoms?
And in general, if you are experiencing symptoms, and John did speak to this somewhat, managing your symptoms at home means managing your fever, so checking your temperature, keeping track of your temperature every day. If you have a fever, you can take antipyretic medication that is something like Tylenol or acetaminophen. Also, non-steroidal anti-inflammatories like Advil will work. So making sure that your fever doesn't get too high, and then that also treats aches and pains. And then, of course, staying hydrated and as well-nourished as possible is essential to give your body the strength that it needs to fight the virus. Other things that you can do if you are sick at home, and other things that you must do, self-isolating within your home. That means the sick person needs to be in a room by themselves with the door closed, and they need family or friends to bring them everything that they're going to require to get through their sickness at home to the door, staying at least 6 to 10 feet away from them. So leave it at the door, walk away, let the sick person access whatever it is, be it fluids or medication or any other necessities that they may have, but maintaining that distance within the house. If there's not an ability for the sick person to use a separate bathroom, the sick person needs, to the extent possible, to clean the bathroom after they use it. And so that includes using a household disinfectant spray or a bleach solution if you don't have a spray, in order to clean the toilets, to clean the sink handles, and then the next family person can go in and use the bathroom, but it has to be cleaned between uses. Thank you.
Our next question is, will school closures continue?
In reference to school closures, as you may remember, early on, Clinton County issued an emergency order that allowed schools in our county to close. Later on, the governor of the state of New York issued a overarching emergency order that closed schools, I think, until April 15th or 20th. Michael? April 1st? It's closed schools till April 1st. So the governor's order is the overarching order on that. However, school superintendents have a lot to say, obviously, about their individual schools. So working with the superintendents, working with CV Tech and BOCES, Dr. Davey, and with the governor's office, those decisions will be made, I expect, by the governor of the state of New York in conjunction with the school superintendents. I'd also like to take just a second to thank all of the school superintendents who have done just an awesome job in our county. In closing the schools continue to teach children online. They continue to feed children. Beekmantown, Shazy, for example, all the schools have done just a terrific job in very short notice on what they've done. And if I could be a little parochial, I'd like to say hello to my daughter, Kristen, who's a teacher. Hang in there.
To prevent an influx of people from downstate traveling to Clinton County?
Thank you. The short answer is no. The governor has made it crystal clear that people within the state of New York can still move about, can still go to their second homes. We have no plans to stop that in this county. Obviously, I do not speak for the governor, but as of the last conversations I saw, he has no plans to do that as well. However, we would like to emphasize, please stay where you're at. This is all about, it was sheltering in place, now it's staying home, stay safe, so please stay home, stay safe. We have to stop the spread of this virus. We have to flatten the curve, as we keep saying. So, no, there are no official plans to close the county.
Are the people currently quarantined by the health department being tested?
Not everyone who is placed, and I'm going to be careful with terminology here, in either quarantine or isolation necessarily get tested. Quarantine is for people who are asymptomatic. They do not have symptoms of the virus. They would not get tested regardless. If there are no symptoms, a test may or may not show any results whatsoever. So we are definitely not testing people who do not have symptoms. That said, if someone is placed in isolation by the health department, they may have symptoms. However, because we do not have enough tests to test everybody with symptoms, we are testing those who are potentially at risk for infecting a lot of other people. If they develop symptoms after they've been placed in quarantine and they have been nowhere except their own homes and they have not infected any additional people that we would need to then do further contact tracing on, they are not getting tested at this time.
What can families do to protect their home if one member of the family is deemed an essential employee and has to leave the home?
That's a good question. One family member going out and coming back, of course, does potentially bring the risk of introducing the virus into the household. I can recommend what we do in our household, which is the first thing that happens as soon as anyone walks in the door is hand washing. We wash our hands. Of course, we take our shoes off at the door, so that's first. Wash our hands, and then my husband and I both will shower immediately. We take our clothes that can be washed in the washing machine, put them in the washing machine along with the towels that we've just used, and wash them. And then any clothes that cannot go into the washing machine, what we have been doing in our household is putting them directly into the dryer on hot heat for 30 minutes to try to further reduce any potential lingering virus that may be on our clothing. We also definitely recommend cleaning the household on a regular basis. That includes the high-touch surfaces, countertops, doorknobs, refrigerator handles, drawer pulls, cabinet handles. The things that people touch the most often get wiped down every evening as soon as I get home from work and have gone through my own personal decontamination process. And it may seem like a lot of effort, but it is something that we can do to avoid giving this virus to our loved ones if we have encountered it while we've been out in the community.
Can you just explain a little bit further why someone might be placed in quarantine?
Are placed in quarantine because they have had contact with a person who has COVID-19. Now, what is getting extremely difficult for us due to lack of test kits is making a definitive determination on who the people who have COVID-19 are. So again, when we have a confirmatory test results, their contacts who are asymptomatic get placed in quarantine. Of course, their contacts who are symptomatic get placed in isolation, and then further contact tracing is done for those people. What we are now finding in the community is that there may be people who have symptomatics that are clinically consistent with a COVID-19 diagnosis, and that includes fever. They may have diagnosed chest x-ray indication that they are infected, for example, pneumonia, cough, shortness of breath, and there are some additional symptoms that some people are experiencing, like GI upset or gastrointestinal upset, their stomach hurts. And so the people who have the symptoms, who are not able to be tested but are well enough to continue to remain in their home for the duration of their illness, are being asked to self-isolate, and then their contacts are being asked to self-quarantine. At this point in time, we do not have the capacity to issue legal quarantine orders for everyone who may meet the definition of a contact for a person who doesn't have a confirmatory test results. But if you are in a situation where you have to remain in your home in quarantine because you are very certain that you have been in direct, close contact with someone who is ill enough with consistent symptoms to be a potential case of COVID-19, if you are that category of person in that type of quarantine, we can work with you to help you know what you should do in your home, and if you need help working with your employer, we can help work with your employer. So I want to be careful about this because we do get quite a volume of calls thinking that someone is a contact of a contact or they know someone. Just because you may have known someone with symptoms does not mean you are a contact. We're talking about close contacts. So this gets very difficult to define. It gets very complicated. But if you are sick with symptoms, please self-isolate yourself. And if you are a close contact of that sick person, please self-quarantine yourself. And the CDC website has excellent guidance on how to implement those activities. I do recommend their website.
Next question, if anyone can speak to this, why can't prison guards wear masks and gloves?
I don't think it's so much of an issue of why can't they wear masks and gloves. I think, as been stated by many people on today's panel, there's a shortage everywhere for everything. And from what I understand, we've just begun the climb. We're not at the top of the hill yet. And for everybody to start wearing masks and gloves, if it gets to the point where our healthcare providers need to address medically certain issues with people, they're not going to be able to do that. In our jail, we urge people, if you are handling somebody who has not been in our custody for 14 days or more and they're suspect of anything whatsoever, we bought portable eye goggles that they can put on to protect their eyes. We also have a supply of gloves that are available and certainly masks when necessary. But just to wear them around the clock when you're working, from what I'm understanding, there's not really a necessity for that. It's not really going to do an awful lot of benefit, but certainly is not discouraged when handling those cases of need.
We're going to follow up with our last question here. What is the county or the towns doing to help with the payment of property and school taxes?
Thank you. In a nutshell, for property taxes, there is 3 levels of government for this: the town, the county, and the state. The county, as I have addressed earlier, has done 2 things already. The county has worked on eliminating the penalties for mortgage payments for March. And the second thing we have done is we have allowed the foreclosure process to come to an end for this year. There will be no property foreclosures based on the county taxes for this year. Those will be rolled over into next year to give folks a chance to catch up during these hard times. The school taxes are really not anything the county can do much about. The school taxes are up to the schools. As I said, there's the town piece, the county piece, and the state piece. Real property tax law is very complex, so the schools will have to address that. The county is doing what it can now, working with the Treasurer's Office. The state of New York has a distinct and overarching responsibilities and regulations on that, and the state of New York will have to, and the governor will have to look to the future to see what they can do for that. Michael.
We also are reaching out to the townships, so anything, and advising them that anything that's within their ability to do, we are asking them to look, because there's only certain things through the county, we only can deal with what is available, our options, but we are also working with the townships to inform them of opportunities that may be available to them.
Thank you. If you couldn't hear, Mike Zerlo, our county executive, is here. And as I said earlier, there's a town piece, and the county is working with the towns to make suggestions to them on things they can consider regarding property taxes.
Thank you for joining us for this media conference today. We hope that the information that has been provided has been helpful. I'd like to thank our speakers, and I'd also like to thank the support personnel in the room who are bringing these questions to our attention and allowing the speakers to answer them. I did want to just note that we just received a text that the governor has been making his announcements today, and that he just announced that schools will remain closed until April 15th. So if you're looking for more information on that, you may want to check on the live stream that the governor is doing as of today. We did want to just let you know that this live stream will be posted to our CCHD Facebook page, so you can view it again later, or if you didn't get an opportunity to see it now, you'll be able to see that later. We do also have the call center here at Clinton County Health Department, so if you have additional questions, those can be called to 518-565-4840. And as always, we'll be answering questions through Facebook and any other method through our website. We're happy to answer questions for you to the best of our ability and or direct you to someone who can. Thank you.